we've all heard of the potential of a Covid-19 vaccine.
What could free us is a vaccine.
A vaccine.
A coronavirus vaccine
is the only way.
A vaccine.
The Holy Grail.
The most urgent, shared endeavour of our lifetime.
In recent weeks, however, there's been a more cautious tone.
This virus may become just another endemic virus in our communities, and this virus may never go away.
I don't want people to think that this is all dependent on vaccine.
I believe I'm right in saying that even after 18 years, we still don't have a vaccine for SARS.
And they're right to be cautious because the chances of the Covid-19 vaccine being the magic bullet out of this situation are very slim. Here's why. Looking back at history, there are plenty of diseases that have never had a vaccine. Take SARS, HIV, dengue fever, and malaria, just to name a few examples. And that's because creating an effective vaccine is really hard. Using traditional methods, a purified component of the virus would be injected into humans in low doses to trigger an immune response. The idea being that when the virus strikes, our body is ready to fight it off. This kind of vaccine typically has a lead time from lab to humans of 10, maybe 20 years. With modern technology, that timeline can be significantly compressed. We can now create vaccines without actually having a specimen of the virus, so long as we know its genetic sequence. That's why within just 3 hours of Chinese officials publishing the genetic sequence for Covid-19 on January the 10th, one pharmaceutical company all the way in Pennsylvania already had a prototype ready for testing.
We've managed to accelerate the timelines considerably.
And with more than 100 potential vaccines currently under development, the idea is that surely one of these will do the trick. But success is by no means guaranteed. For starters, we don't know which approach will work or the degree by which they will work. Some vaccines that are being tested on animals might not be effective in triggering an immune response in humans. Others that are already in human trials might work well when tested in young, healthy adults, but not those in the 70+ age range. And some vaccines could actually make Covid-19 patients sicker than if they contracted the disease naturally.
I must warn that there's also the possibility of negative consequences, where certain vaccines can actually enhance the negative effect of the infection.
To be certain that the vaccine works, it would need to be tested in an area where there's lots of Covid-19, so that those who are vaccinated are regularly exposed to the virus. That might be tricky now that lockdown has reduced the rate of transmission so dramatically. In other words, testing might take a very long time. And the story doesn't end there. Once the testing hurdle is passed and a vaccine has been found, it needs to be manufactured en masse. It's thought that 60 to 70% of the global population need to be vaccinated to get to herd immunity. That means manufacturing and distributing 5 billion copies of the vaccine. Most G20 countries don't even have the manufacturing capacity to meet that kind of demand, which means realistically, any vaccine will need to be rolled out in batches of millions. And there's another twist. Covid-19 is constantly mutating. Scientists have already identified 198 mutations since the emergence of Covid-19. So far, these mutations do not appear to have affected the virus's distinctive spike protein, which is what most vaccine efforts are focused on. But that could change. The seasonal flu jab, for example, is only effective in reducing the risk of flu in 40 to 60% of the population, and is updated every year to account for new strains. The point is, the search for an effective vaccine is long and hard. And while we focus our efforts on this race, it might also be worth taking a step back and looking at the broader issue. How do we avoid a situation like this again? Infectious disease outbreaks are not new, and they stem from how we treat the natural world. Strains from avian flu repeatedly emerge from chicken farms, bouts of swine flu from pig farms, and that's before taking into account novel diseases that seem to come out of nowhere, such as SARS, MERS, Ebola, or even Covid-19. We know that 3 out of 4 new infectious diseases come from animals, and it's no surprise that this trend has increased as our farming methods have intensified. At this rate, we'll find ourselves in a race for a cure for a novel virus every few years. This doesn't make any sense, and it doesn't need to be this way. But we're not helpless, and each of us can make a difference.